This is a quick demo of how to use the Haplo web extension to accelerate your documentation using the Kinnser application. And so what I'll do is while I'm on the road on my cell phone, I'll start a new visit here and I'll go to the Haplo Home Health website. I will hit the record button here, which will pull up this template of what the Haplo AI can help you transcribe. And so what I'll do is while I'm in the car looking at the patient's HMP, I will start the document. I'll hit record. And for example, the primary medical diagnosis is congestive heart failure with an onset date of April 15th, 2024. The occupational therapy diagnosis is muscle weakness with exacerbation date of April 15th, 2024. Patient is 85-year-old female, recently hospitalized with congestive heart failure after experiencing shortness of breath and chest pain. Past medical history significant for hypertension, hyperlipidemia, dementia. And then I'll go ahead and hit pause. And you can see here that the application has transcribed our text. And what I'll do is I'll go ahead and complete my evaluation. I'll take a few notes and then I'll come back to my car and finish my documentation. So I'll hit resume here. Let's say the time in was from 11 a.m. to 12. Visit date was April 15th, 2024. Associated mileage was 5. Documentation time is estimated to be 40 minutes. And the travel time was 16 minutes. Then I can go down the list here and basically fill out all the prompts here. Let's say the prior level of functioning was modified independent with self-care using the walker for household mobility, assistance with all IADLs from family. Patient goals are to regain strength and mobility, and precautions are congestive heart failure, fall risk, and dementia. So if I was completing the entire evaluation, I would of course complete all the prompts on the list there. And I do notice that the more that you fill out and if you maintain the order that it presents them, it has the best ability to fill out your evaluation. But anyway, so I would fill out that whole prompt, then I'd hit generate prompt. I will move on to my next patient, and when I come home at night to complete my documentation on a laptop, I'll go ahead and pull up the patient's chart. I'll open the Kinnser application here. I'll find my corresponding patient. I'll click apply on web. So we see here 11 to 12. We have the visit date, associated mileage, and we have all the information that we've provided it. Now, we didn't fill out the entire evaluation, but you get the idea. So there are some boxes that the application can't fill you out with, but it does have some other features. So you'll notice now that anytime you click on a box here, you're going to have a little blue icon. And what I'll do here is I'll create specific hotkeys for each field. So here I have my specific hotkey pre-saved for the homebound status icon here, and then I'll just add the specific diagnosis of congestive heart failure, and I'll fill out some other specifics. The other thing you'll notice is that now some of these boxes have blue rings. So as I'm going through my evaluation, I can toggle here the check mark, and what this does is it's going to add it to my visit summary. So I want my relevant medical history, I want my prior level of functioning. So let's just pretend I'm going down this evaluation, and again, it's not filled out here because we didn't provide it all the information. And then what I'm going to go ahead and do is when I get to my evaluation summary, all the boxes that I have a check mark for that I've selected. So for example, let's fill out the Barthel's index here. Let's say it gave this score, and then I go ahead and I toggle it on here. I now have a blue ring here, and when I go to my visit summary, I hit paste summary, and it's going to copy in all the boxes that I previously selected.